keeping an eye on imaging. Discussion and commentary based on articles from JACC Cardiovascular Imaging.
Hello, I'm Dr. Christopher Kramer from the University of Virginia and Associate Editor of JACC Cardiovascular Imaging. And it's my pleasure today to be discussing an upcoming paper in JACC Cardiovascular Imaging from the group of Dr. Gregory Hunley at Wake Forest, which will discuss the prognostic implications of dobutamine cardiovascular magnetic resonance stress testing in women. Greg, can you tell me what prompted you to perform this study?
Yes, Chris. We had been performing cardiovascular magnetic resonance stress testing for a number of years. We had previously reported on the diagnostic accuracy of the technique and then also the prognostic utility of the technique. But for the majority of those studies, as well as for many studies that report on stress testing, the predominance of the study populations had really included men. And so we felt it important to try and address the utility of MRI stress testing in women. The reason for that may be important are several-fold. But one, in women that have other forms of stress testing, maybe due to echocardiography or radioisotope imaging, it can be very difficult to acquire high-quality images that are sufficient for interpretation. With magnetic resonance imaging, we can overcome many of those obstacles because we really don't have limitations due to body habitus. And so we thought this was a nice application to go ahead and look at the utility of this form of testing in women, a patient population that would be in need of this form of testing, and perform this study in women that could not or had poor quality images with other forms of imaging, primarily echocardiography or radioisotope imaging.
Can you describe the study population for us?
Yes, the study population are really those women that are commonly referred to us as cardiologists in clinic. Multiple risk factors for coronary disease or myocardial infarction, including high blood pressure, diabetes. The average age of the women in this study was 63 years. And many had chest pain syndromes. They may not have previously been diagnosed with coronary disease, and I would say half of the women fit into that category. The other half of the women, there was a known diagnosis of coronary disease, and we were trying to identify the presence or absence of inducible ischemia.
And how many women did you study in this particular?
In this particular study is of 221 women. They underwent the magnetic resonance imaging procedure and then were followed for about 6 years on average, some 5 years, some as much as 10 years, and we assessed the post-MRI occurrence of cardiovascular death, myocardial infarction, and then admission to the hospital with unstable angina, congestive heart failure. Those were the primary outcomes.
Can you briefly describe the test itself, the stress test?
Yeah, the women received a magnetic resonance imaging stress test that incorporated a dobutamine infusion. Images of wall motion, left ventricular wall motion, were gathered at rest, and then with subsequent increments in dobutamine infusion at low levels and then at peak levels with atropine in order to advance the heart rate response to 85% of the predicted for age.
And can you describe your findings?
Yes, what we observed is that those women that had inducible wall motion abnormalities during testing experienced a 4-fold risk in the incidence of future myocardial infarction or cardiac death, and a 2.5-fold increase in admission to the hospital with congestive heart failure or unstable angina. Those women that did not, conversely, those women that did not exhibit inducible wall motion abnormalities during dobutamine and atropine infusion actually did quite well and had only a 1% incidence per year of any of those cardiac events, myocardial infarction, cardiac death, unstable angina, or congestive heart failure, to be admitted to the hospital.
And where do you see this type of study going forward in the future?
I think, first in the present, For those facilities that have the capability to perform magnetic resonance imaging stress testing, they have the appropriate staff, they have the appropriate MR scanner with protocols, women now have an option such that if there is poor image quality or the physician suspects there will be poor image quality, we can go ahead and have magnetic resonance imaging stress testing to provide a reliable answer to forecast future prognosis. What do I see in the future? I think we'll see larger studies, perhaps multi-center studies. This was a single-center experience that can also look at the efficacy of the technique.
Great. Thanks for coming today.
Thank you very much, Chris. I appreciate the opportunity.
Keeping an eye on imaging.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.